And these health and psychosocial outcomes are important because they drive a lot of what happens in diabetes. They drive funding for different areas. They identify needs. They also help to push and drive new development. But the outcomes are most important to the person experiencing them. So while it's very important from the standpoint of the teams and the work that's being done, they're most important to the people with diabetes and experiencing it on a daily basis. And I think that the desired outcome, probably for everybody in this room, is with diabetes to live a long, healthy, and happy life. So can we achieve that? What do we know about our ability to achieve that? You've heard already some points today. It's very well established that we can reduce the risks of short and long-term health problems through the intensive management of diabetes. This was clearly laid out in the diabetes control and complications trial and studies that have followed, and a number of other trials. And I'll just show you this figure briefly. And one of the things that I want to note here is that over a period of time, so the x-axis along the bottom is the number of years, and then you can see these different lines that illustrate a mean A1C across these large number of years. So this isn't an A1C at one time, it's over an extended period of time. And what you can see is that for individuals in the diabetes control and complications trial, which were mostly adults, you see that lowering A1C, say from 9% to 8.1%, oh, it just got dark. It changed your chances of getting retinopathy or problems with your eyes 40%. So it reduced your risk that much. And it's reducing my eye. So in terms of, so I just want to highlight that, to lay that out as a bit of a foundation. We know that intensive management of diabetes, trying to keep blood glucose levels in range, will ultimately lead to fewer health problems in the short and the long run. Also, Dr. Buckingham made a great point earlier that a person diagnosed today has a chance of developing these very severe kidney problems, 1 to 2%, where it was 50% 30 years ago, or 20 years ago. And in two recent reports, one in diabetes in 2009 and another in diabologia in 2010, in these relatively large samples of individuals with type 1 diabetes, they demonstrated exactly this, that the prevention, the intensive management of diabetes and the prevention of serious kidney problems leads to individuals with type 1 diabetes living as long as their peers. And so this is a very encouraging finding and something that when you think about the data from 20 and 30, 40 years ago, it's very different than what it is now. And early detection and prevention are critical. So routine monitoring by your diabetes team keeps you on the right path. So if you do start to, you or your child start to show some little small signs of some problems, if you catch it early and you have treatment for it, you end up on the same trajectory as everybody else. So this routine maintenance, go to your visits and get these lab values. Early detection is critical in type 1 diabetes. And again, just to kind of reemphasize this point, that a diagnosis today is very different than a diagnosis 10, 20, and 30 years ago. And that advancements in our knowledge and science have dramatically improved both the health and quality of life outcomes when living with type 1 diabetes. So I would like to put a check by this, that it's possible and it's likely, it's probable that a long and healthy life with type 1 diabetes is there. What about happy? So this statement is kind of the opposite of happy, but it's well established that diabetes and its management put individuals and family members at risk for psychological distress, depression, and diabetes burnout. We know this. We know that there's elevated risk, and it's partly why I have a job, and it's partly why other people have jobs who work in kind of the mental health side of it. And it's also why the American Diabetes Association, organizations in Europe, and the International Society for Pediatric and Adolescent Diabetes around the world that we emphasize that it's important to monitor psychological health and well-being. That these are critical factors to screen for and evaluate. Also, distress related to diabetes or in general is preventable and treatable. We also know, and I'll talk about this in a minute, young adults with type 1 diabetes tend to display more maturity than their peers. And any of you who have a 12-year-old or a 15-year-old won't believe this statement, but it really is true. And many youth and young adults with type 1 diabetes also achieve very similar quality of life as their peers. So let's look at some of the data. In a couple of papers that have come out in the last few years, there have been large reviews of prevention and treatment efforts around distress related to diabetes. And across those, they indicate that there are several interventions that are successful. These are the ones that target management behaviors, they target family processes, they target individual coping. They give a full kind of tool belt of things to work with around diabetes management. It's not just learning how to rotate a pump site, it's learning that at a time when it's a little bit stressful in the family or different areas. So all of these focus on this idea of problem solving and individual coping. This is the study I mentioned. This was conducted in Belgium and published in 2010 in Patient Education and Counseling. And they had several hundred they had several hundred young adults with type 1 diabetes and several hundred of their peers that were the same age but didn't have diabetes. And they asked them a number of different questions, and they did interviews and looked at other areas of follow-up. And one of the main findings was that compared with control participants, so those without diabetes, more patients classified themselves as adults. So they perceived themselves as more mature, as older, more like adults than their counterparts that were the same age without diabetes. And also, identifying themselves, classifying themselves as adult was related to better glycemic control. So these are the kids that also achieved better A1C values, if you want to use that term. And I think that this indicates that all of your hard work that's put into helping your child internalize what's important to manage and the focus on health, all of that pays off. It just may not pay off today. It's going to pay off. So keep up the hard work. In a paper that our team published in the Journal of Pediatrics recently, in the search for, so this is looking at data from the Search with Diabetes in Youth study, which is a large prospective observational study in the United States. And in over 2,600 youth with type 1 diabetes, a large proportion of the youth rated their quality of life, so how they were doing from an emotional, social perspective, at the same level as their peers without diabetes. And the poor quality of life, so when they rated themselves as having poor quality of life, or their parents did, was associated with using injections versus a pump. So the kids on pumps tended to report a higher quality of life, as well as the kids that had a cluster of family variables where access to care or support were missing. So these were the ones that potentially struggled to obtain the support from parents or the healthcare system, that they tended to also report a lower quality of life. But when you did report a higher quality of life, and this is consistent with a number of other reports, it's associated with better glycemic control. So we can have these two things come along together, achieving the optimal A1C that your team wants you to achieve, that you want to achieve, as well as optimal health-related quality of life. It's really possible. So again, I think we can put a check mark here. So the strategies that 2 through 5 really focus on ways to achieve our desired outcome of this long, healthy, and happy life. So the second one deals with paying attention to your psychological health and your child's. And you can do this by screening yourself. You can ask for the support that you need. Here are a couple of examples. These might be good questions to ask yourself if you're feeling burned out about diabetes. Does your routine feel like it's getting old? Do you check less often than you should because you don't want to see a high number? Do you give up on your idea of doing something new, like the insulin pump or some other technology? Do you feel overwhelmed by diabetes? If you answer yes to these questions, these are indicators that you're probably feeling a little bit burned out or stressed. And maybe you can answer yes to these questions on a daily basis, or maybe it goes for weeks before you feel this way. But when you do, it's important to get some help. I started to describe a little bit of the help that you should seek out. I'll give it a little bit more. Our team looked at about 15 different randomized clinical trials, and then we combined all of the results of those trials into what we call meta-analysis. And what we found was, what we were interested in looking at was these studies that were trying to change self-management behaviors, family management of diabetes, how effective were they in changing A1C? So we can give all these interventions, but did we move the dial a little bit on improving A1C? And along the bottom, you can see just the metric that's used to show how much change happens. Along the left side are all the studies. And if you follow the red line down, which is the mean across all of these studies, you see that we didn't do, across these 15 interventions when pulled together, we don't do a very good job of moving A1C in the positive direction with these interventions. When you take all that's out there. But when you separate out a few, there's 5 or 6 here that I think you can categorize as multi-component interventions. And what you see in these interventions are that they did change A1C through this process of improving adherence and management.
Excuse me, quick question. The scale to the right is improved, is that correct?
Right, it is. It's kind of flipped than what you think. So it's, for the purposes of publication, it's a health promotion, and so on the positive side. Sorry, thanks for pointing that out. But in these cases, and this metric that's used, show that some of these interventions were changing A1C as much as 1% across 6 to 9 months. And so these multi-component interventions are things that target the management tasks. So they target the skills that we all need in terms of blood glucose monitoring, insulin administration, site rotations, but also focus on individual coping, family functioning, and problem solving. So they don't just focus on the behaviors or the person conducting those behaviors, they focus on the entire system. So it's not just help with management, it's talking about communication within the family, problem solving in different situations, and owning and coping with diabetes. But these are the kinds of interventions that, when delivered, are going to be the things that effectively change management and control.